The Limpopo Health MEC has come under fire this week for chastising a Zimbabwean patient about the impact of foreign nationals on the South African public health care system. MEC Poppy Ramathuba was recorded berating the woman in a Bela Bela hospital. Now, there have been calls for the MEC to be fired, and the incident has brought the ailing healthcare system back under the spotlight. There's a debate about the Hippocratic Oath, humanitarian obligations and the financial pressures faced by government health institutions. For more, we're joined now by Dr. Aslam Dasu, who's the convener of the Progressive Health Forum, and Professor Susan Cleary from the UCT School of Public Health. Thank you both for joining us this morning. And Dr. Dasu, I think I might start with you in just getting a sense of your thoughts of that video when it was released. A lot of outrage, but also a lot of South Africans who perhaps may have agreed with what the MEC highlighted while talking or berating the patient at the hospital.
Good morning. Thank you for inviting me, and good morning to Susan Cleary as well. Look, this is a shocking but a pretty straightforward situation. We have a professional element to it and a political element. And in terms of the professional element, the way the MEC engaged in this matter is completely at odds with the ethical duties of anyone who is licensed to practice healthcare and medicine. And I think just on that basis alone, a severe sanction must be applied. No health worker is ever entitled to deal with a patient in that way, whoever the patient is. An abiding code is that health workers do not discriminate against anyone on the basis of their origin, their creed, their race. Indeed, we fought that during apartheid. To have to be subjected to that again in a democratic order is unacceptable. On the political side, I'm happy to discuss that too, because I think what happened here was scapegoating and deflection. The fact that there's up to 50% of the national public health budget is compromised, either by corruption, by misspending, by mismanagement, is never brought up. But the tiny amount of that massive budget that is spent on undocumented migrants is put up as the cause of the failure. Now, this is the way populist politicians will try to deflect from their own lack of responsibility in the public health system and in its management. So the entire episode is so utterly distasteful that, and this entitled, haughty, arrogant politician, abusing and vulnerable patient makes her unfit for office, and she should resign forthwith.
Prof. Cleary, I think that's probably one of the reasons why people are now calling it's the oath that you take as a medical professional a Hippocratic one, because as Doc Dasu has indicated there, that is no way to treat not only another human being, but a patient. So one wonders about the state of our healthcare system and really the kind of treatment that people are getting that is not recorded on our devices for us to share with everybody else.
Yes, thanks very much, and thanks for the opportunity to join you this morning. So in my opinion, it was clearly a very unfortunate incident. And one would not want to see that happening at a bedside anywhere in this country. However, every country in the world does ration healthcare in one way or another. The hope is that that rationing is done through an explicit process of determining a healthcare benefits package so that it's fully clear about who is covered and what is covered. And these decisions need to be taken ideally at a national level and be within appropriate national legislation. At the moment, under our National Health Act, Zimbabwean citizens are entitled to the same health care as South Africans. And so that is what we then need to provide. However, hospital care is not actually free in this country. It is means tested. And so that Zimbabwean national would have had to have gone through a means test just like any other South African would have had to have done. And so it's not the case that we are providing free healthcare in hospitals to Zimbabweans on a routine basis. Instead, there is a means test, and potentially if you are in the higher income bracket, which is not particularly high at all, you pay a lot. And so it is far from free at the moment. If we were to get a national health insurance, that potentially would change. But I think for me, the key thing is that we have to make an explicit decision about who is covered and about what we cover. And just to remember that we are a resource-poor setting, but every country in the world has scarcity in terms of their healthcare. And so the question is, how do you decide? What are you going to cover? And how do you communicate that appropriately to the members of your health system?
Dr. Dasu, the Prof raises a very valid point there in the allocation of resources and who has access to those resources within the country. And it's an interesting one because we see time and time again nurses, doctors sitting at home without jobs. And so it's not that the resources don't exist, but one wonders about the political will and really just creating an environment where these resources can be absorbed into the healthcare system so that it can be defined at in terms of what capacity it can provide. I mean, it really just puzzles and concerns me that we are sitting at this stage in 2022, and I'm just trying to gauge your thoughts on the back of what the Prof has mentioned there.
Look, I think Prof clearly has set it out very, very straightforward and clearly about what the broader parameters are about the provision of health services for nationals and for foreign nationals. Here, however, we find that this is the blame for the ills of the system, if I can use that phrase, is placed on a vulnerable, helpless patient. And in the manner in which the issue is raised, the issue is prosecuted, it deflects from the very important issues that Prof clearly raised. Now, in 1994 already, this issue of transnationals, cross-border treatment of people was raised. It has been a formal government policy discussion. However, 30 years later almost, we have not gotten any closer to a solution. We have no arrangements with our neighboring countries about the treatment of their foreign nationals. We have a constitutional order that prohibits discrimination against anyone seeking health care, the means test notwithstanding. But yet, we still behave, and politicians behave, as though the people coming across the border seeking care, this is very important. They come across a broken immigration infrastructure. They come across sometimes under harrowing circumstances. They don't do this for fun. They need the care. The fact that we have a failed state on our border, which isn't able to provide public health services to its people, should not be blamed on the people. A young woman seeking to deliver her child safely and can't do it in Zimbabwe goes through this harrowing journey to find the care she needs. If she gets to that facility, she must be given all the care that she needs. And the thing about the politicians blaming her is so populist. It plays into this xenophobic narrative emerging in our country, where politicians try to out-xenophobe one another for the vote. And they stir up the grievances of the people in order to do that. So unless people understand that we are resource constrained, for sure, we are managing our health system very poorly, for sure. And then we have an immigration system and a broken border, which allows the influx of people justifiably seeking healthcare for themselves and then berate them for it. That's just not acceptable. That is not what a civilizational, constitutional order allows or should allow. anywhere in the world. Migrants get this kind of treatment wherever we see it in Europe, we see it in other parts of Africa, we see it in the Middle East. Why must we perpetuate this Afrophobia? I do not understand it. And the people defending the MEC's position on this are completely ignoring the fact that we are a human rights-based country and that we must always protect the human rights of our citizens and those who are within our borders.
And Professor Cleary, those who do defend the MEC speak to one of the points you made in your previous answer, in that it's an issue of the allocation of resources and funds. And that is basically what they're saying, is that these funds should be prioritized for South Africans first, and whatever's left will then be used for those who come from neighboring countries seeking medical attention. Of course, this is not a sustainable solution because, as Dr. Dasu has mentioned, we've got people flooding in all the time looking for basic services that their own countries cannot give them. So when one looks at the situation, is there an immediate kind of solution when we look at the health economics of the healthcare system in South Africa to really do the best that it can in the current situation?
Thank you. I think it's very important that we don't allow these situations to further polarize us and to set ourselves up against our neighbors. I think that we have to adhere to our current National Health Act and continue to provide the services that we have committed to providing. I think that there is an opportunity to engage with our neighbors about payment for those services, and that could help us with our resource-constrained situation. But generally speaking, we are going to continue to find ourselves in a highly resource-constrained situation on an ongoing basis, and that is a normal situation to be in healthcare. We are never going to have the amount of money that the American health system has, and there are always going to be effective interventions that we are not going to be able to provide. The key is to be more transparent and perhaps more honest about what it is that we're able to do. We have a tendency in South Africa to be highly aspirational in our health policies, and in a way we set ourselves up for failure. And my concern with our tendency towards being aspirational is that for the frontline health worker, they are faced with an impossible job on a daily basis, and then are often blamed when the service isn't available or isn't delivered at an adequate quality. And that leads to high levels of demotivation and dysfunction in the health system. We have a number of other issues to do with corruption, and I think that that is clearly the case. We have issues of management and leadership that are extremely pressing. But in addition to all of that, we have a need to be honest about where we are and the resources that we do have, and be clear about what we are going to provide and what we are unable to provide, so that we give our health workers, when they arrive at work in the morning, they should feel that it is in fact possible for them to do their job well.
And we have run out of time, but I have to ask you before I let you go, Dr. Dasu, this issue of corruption is a big one. You know, the Tembisa hospital situation is but one example of the kind of malfeasance that happens within the healthcare system. And it raises a very important question around oversight and ensuring that people are actually doing their jobs and spending money in the right way.
Yes, absolutely. This is actually, I think, one of the biggest problems we face. And I agree with Prof. Cleary about how this impacts on the front line. Now, you might have heard 2 weeks ago or 3 weeks ago, the president announcing that the SIU will be doing a deep dive investigation into 11 government departments, 10 of which are our various health departments. It's been flagged as the sector which is most prone to corruption. And you know, we see it, and this is a huge budget, so poorly managed. And in fact, our facilities are often under the control of people who are either dishonest, incompetent, or are placed there for specific reasons that has got nothing to do with managing an effective system. So you're quite correct to raise this. The problem, and as Prof. clearly said, it must be resolved at an international level. For 30 years, they've been prevaricating. I can't understand why this can't be resolved. And if it is not resolved, then it is still incorrect to berate vulnerable people, migrants who are seeking care, documented or undocumented. And because the responsibility for fixing that lies with the same people who are deflecting from those responsibilities. So it's a very big problem, but it's not going to end here. They need to understand, that is the authorities, that health workers are organized. They have found their voice, like they did in the Tim de Meyer matter, and the I Am movement made it clear that they will not be silenced and that they will act. We fought it before, we will fight it again. They need to understand this.
Thank you very much for your time. That is Progressive Health Forum's Dr. Aslam Dasu and UCT Public Health Professor Susan Cleary joining us this morning to have that all-important conversation about the country's healthcare system and who needs to be blamed for the way that it runs or doesn't run in the instances that you've seen in the media recently.